Welcome to today's special episode. As we approach the autumn statement, there's a growing conversation about the future of adult social care. My name's Gavin Chase of the Chasing Care podcast, and today we'd like to look at the autumn statement and maybe make a few suggestions that the government should consider. With more than 418,000 people awaiting assessment or support, it's clear that adult social care is facing a significant challenge. We've talked about it before. And in this short podcast, we'll unpack some of the key issues highlighted in their latest report from the Association of Directors of Adult Social Services, otherwise known as ADASS. And we'll discuss what action the government might like to consider. So first of all, the current state of adult social care in the UK provides vital support for those with mental health issues, physical disabilities, learning disabilities, and older adults needing assistance. It's not just about healthcare. It enables people to work, socialise, and contribute to their communities and give them self-worth. However, the sector is under immense pressure. For 2023 and 2024, councils faced a £586 million overspend in adult social care. And I read today that a local authority in the Wiltshire area was indicating that they anticipate in their budget an £8 million overspend due to health and social care costs. Broadly, for the next financial year, councils are expected to make £1 billion in cuts. So what's the result of that? £1 billion in cuts. Well, that will lead to growing waiting lists, with nearly 500,000 people still waiting for crucial care services. What becomes more concerning is that the majority of councils are relying on reserve. But that is not a sustainable solution to their finance needs. ADASS suggested in a recent report that there are several key things that the government can act on or should act on as a priority. Let's take a look at some of those. First of all, we look at continued funding certainty, meaning early confirmation of adult social care grant funding, which is crucial to provide stability for councils and care providers. Remember, it's largely the private sector care providers that was established under the Labour government many, many moons ago that actually deliver the care. And we know, because the Home Care Association, for example, on the delivery of home care, indicate quite clearly that the amount being paid to the care providers to deliver home care is way below the rate that is required in order to make their businesses sustainable. So there's a balance between local authorities not being funded correctly local authorities having to overspend because, of course, there's more people that are over the age of 65, 75, 85 than there ever has been. And the care providers that are trying to deliver the care but not getting the money for it. So they can't pay the wages of their care workers. They can't invest in the training that's required for their care workers. They can't afford to keep their office running because of rent, etc., etc. So we look at that continued funding certainty. That means that somebody's going to find the money because somebody has to pay. And I've just touched on the fair pay for the social workers. In the past, we've spoken about the challenges that exist within the care sector. 152,000 vacancies in the health and social care space in the community. Retention issues growing. It's always been high, the loss of care workers, and now it's running at close to a quarter of all people in the sector are likely to leave the sector. 25% of care workers come and go every year. So there's an urgent need to find a way to come with a fair pay agreement to improve the working conditions in the care sector. Now, I can only really speak from the home care and supported living space, but I do know that care providers try extremely hard to ensure that their carers are well looked after. It's not that they're trying to take additional margins and profits out of their business. In fact, I was talking to a provider today that's indicated to me that for every hour of care he delivers through his business into a local authority in the north, it's actually costing him £1 per hour. So for every hour of care that he's delivering into the local authority, it's actually costing him £1. And the only way that he covers that is through the private client network. That isn't sustainable. That means to say, if it continues forever, the local authority isn't going to get the support they need from care providers, is it? It's just obvious. Nobody wants to run a business at a loss. ADASS also talks about increased thresholds for financial support. So the current capital thresholds for care support haven't risen in line with inflation since 2010. We also need to address the recruitment and retention of care workers in a bit more detail. So how do we look at the workforce and carer support? If we look at that, we might be able to address some of the staffing crisis. Better financial support, better emotional support, better training, a valued career path within the care sector. And with over 5 million, some say 10 million people who are unpaid carers, that's family members looking after a loved one. We touched on this just the other day. 600 people a week are actually leaving their jobs to look after somebody in their family because they can't get the support financially from a local authority and they don't have the money to pay themselves. So they physically have to give up work. So they need the emotional support because they provide a critical role in the care sector too. What the government should consider, given the financial constraints highlighted by the Office of Budget Responsibility, is to invest time in delivering a strategic and immediate action. And I'm going to give you some ideas as to what might be considered, or maybe they should be considering. First one is to commit to a multi-year funding, meaning offering the councils a longer-term financial certainty so they can help plan more effectively, allowing a better service, better delivery, without the need to implement sudden cutbacks. There's also the need to prioritise fair pay for care workers. The care worker crisis cannot be overstated. Investing in fair wages and finding a way to be able to deliver that to care workers can help turn around the issue of staff retention in the sector. And we've got to look at reforming the eligibility criteria. That's adjusting the capital thresholds for care eligibility to match inflation and expand it across all essential services. This is especially required as the need for care continues to grow. Focusing on preventative care is something that I believe is not talked about enough. Funding community-based prevention, community-based education, that would relieve a significant amount of pressure on hospitals and all crisis services, and saving costs and improving quality of life. Well, in conclusion, my call to action is broad and wide, and we can't have all the answers here. But ahead of the autumn statement, I accept that the government faces tough financial decisions. But investment in adult social care is not just a cost. It's an investment in our society's future. ADASS highlighted in their proposal some practical steps that could help reform the system, and my comments today reflect many of their thoughts. But they will need bold action. They talk about reviewing care and coming up with a long-term care plan. But now is the time to actually put their plan on paper. We cannot, moving forward, continue to expect the local authorities to pick up the pieces of the failing care system without adequate funding. Now really is the time to prioritise social care so we can ensure that all vulnerable individuals receive the support they deserve and need. At the same time, ensuring that the workforce is valued for their essential contributions. I hope you found this conversation today interesting. If you did, please join us the next time, and it would be really appreciated if you could subscribe, like, and share. It makes a significant difference to the growth of Chasing Care. Till the next time, have a great day.